everyone. Dr. Jeff here with you again this week with co-student Colin. And Colin, what are we talking about this week?
So this week we're going to talk about the AC joint, or the acromioclavicular joint.
So that's your shoulder. So in your shoulder, you've got the clavicle, which comes out from your sternum out to the tip of your shoulder. In the back, you've got the shoulder blade. And at the top of the shoulder blade, you have a big lump on the top of it. It's called the acromion. And what happens is the clavicle comes out to attach to the acromion. In order to get your arm over your head, what has to happen is the clavicle has to lift up a little bit, and the acromion underneath it the shoulder blade will rotate in order to allow your arm to get over your head. And a few things can go wrong with this joint, and one of those things is arthritis. And as we get older, you get arthritis in different joints, and the shoulder is one joint that can get arthritis. Starts to be very painful. One thing we notice with arthritis is it gets more and more difficult to get your arm to come across this way because you're jamming the joint together. So as far as treatment is concerned with arthritis, is really, you're taking anti-inflammatories, you're putting ice on it. You can actually get some PRP injections, which is plasma-rich platelets injections, which is a way to regenerate the cartilage. They will still do cortisone injections on it. If worse comes to worse, they'll actually shave off the end of the bone to get rid of the bone on bone. The problem with that is that now you really don't have much of a joint left anymore, so a lot of overhead work after that will be very difficult for you to do.
Another thing that can happen is you can have an AC separation, or it's realistically more like a sprain. So what happens is if you fall out on your hands, or you fall on the tip of your shoulder, or if you're playing hockey and you get hit really hard and this comes up like this, what's going to happen is your clavicle is going to go over top of your acromion. And what happens there is you're going to have a bulge, and the ligaments that support this joint are going to get strained. So sort of like if you have a knee strain or a wrist strain, and that's what's going to cause that bulge to happen. And some treatment with this is you're going to put a sling on it, and you're just going to rest it, you're going to ice it, you're maybe going to put take some anti-inflammatories and put some laser, some IFC, and over 4 to 6 weeks then we're going to try to get you to do some exercises to try and restore your range of motion. And eventually you'll get most of your range of motion back, but the problem is if you continue to separate your shoulder, what can happen is they might have to go in surgically because those ligaments will continue getting sprained and become very loose.
So yeah, it's when I'm sitting in my office and I'm helping some of my patients, it's interesting because I can tell to them. I said, "Hey, you separate your shoulder at some point." And they'll say, "Yeah, I was playing football and something happened and popped up." "How do you know that?" I said, "Well, you still got the lump from it." They get pretty used to seeing it and don't really know they have it anymore. But it's certainly something that's going to be with you for the rest of your life. It doesn't really go away. It may shrink over time because the swelling goes down, but it really never goes away. So it's something that it might be fun at parties to show everybody your shoulder. The last thing I'm going to talk about is called the impingement syndrome, and what that is that where the acromion meets the clavicle, you've got a little canal in there. You have a muscle called the supraspinatus, which kind of runs from here down through that canal. And for people that do a lot of work over their heads, painters or tennis players or badminton players, whatever it is, they do a lot of work over the head. They can kind of repetitively strain or overuse that tendon. Starts to get a little thick, it swells up, and now it gets difficult for it to get through the canal. So this one here, lifting your arm becomes very difficult, whereas arthritis is coming across here becomes very difficult. So coming up like this, what happens is that tendon can't really get through the canal very well. And then what can happen is that if you keep using it, the tendon rubs more and more and more, it gets more and more inflamed to the point where you get less and less range with it. Impingement syndrome can be a little more difficult to get rid of. Quite often it's very similar to what we did with a separation. Rest, ice, anti-inflammatory medication. And again, we'll get in there. I'll do some ART on it. We can get some laser going on that. And try and get some exercise to get your range of motion back. But generally, it can take us a few months to get this impingement syndrome better. But generally, 89% of the time, we will get it better, and you can get back to playing your sports and back to full use. So there are things we can do for it.
And as always, if you like the video, make sure to give us a big thumbs up. Make sure to follow us on Facebook, Instagram, and YouTube. And if you have any questions about what we talked about today or on any other videos, or have any suggestions, feel free to email us at jgoldsworthy@goldsworthywellness.com. And as always, here at Goldsworthy Wellness,
we got your back.